Answer, thank you. And we continue that conversation as to who gets this life-saving COVID treatment. A new report, right, highlighted by BuzzFeed, found social racial inequities in the use of life-saving COVID treatments. Hispanics face the most barriers. They had access to the monoclonal antibody treatment 58% less often than their non-Hispanic counterparts. That treatment regimen has been shown to prevent hospitalizations and deaths. Asian patients and those who identified as other received that antibody treatment about 47% less often, while blacks, well, they were treated 22% less often. And here's a more recent and bigger problem. Conservative groups have threatened lawsuits against states like Utah and Minnesota that floated the idea of race-based monoclonal antibody treatment. And now those states have backed out of prioritizing those treatments in minority communities where, quite frankly, they are needed the most. So here to talk about these treatments and inequities and what can be done to address this, we have Dr. Stella Safo. She's a primary care physician. She's also the founder of the Just Equity for Health in New York City. It's a pleasure to have you, doctor. Thank you. So let's jump right in. The FDA itself includes race and ethnicity as a potential risk factor for catching COVID. Why is it so difficult to make that official consideration for who gets this scarce treatment, right? I mean, it's in short supply at this point.
I'm to tell you that a certain disease condition that I made up, affects a certain population more, and then I told you I had a treatment, you would deduce that we should give the treatment to the population that it affects more. It boggles the mind that we are at this place where we can look at the numbers and realize that Black Americans and essentially non-white groups have higher rates of COVID, higher rates of hospitalization, higher rates of death from COVID. And yet, when we have treatments for these groups that could actually decrease those rates, we don't prioritize the reality that those are the groups that need it the most. I continue to remain confused by it. And I think to your question of why, we have to look at this country's history of inequities and specifically of structural and institutional racism and interpersonal racism and how all of that plays into the decisions that we're seeing today. It is unfortunate, but I think we are suffering from that with what you've described.
Yeah, our chief medical editor, Dr. Corey Adair, highlighted this very issue months ago and how Black people weren't being offered this life-saving treatment. I want to play devil's advocate here for a second. Is it about not being offered the treatment, or is it about not being able to advocate properly for yourself and requesting the treatment? What do you think it is?
So monoclonal antibodies, for those who don't know, are usually injectables. They're medications you get over a period of time in a healthcare facility. So that means a couple of things, and it's an excellent question that you're asking. It means that we have to understand how people are going to get to the place where a health system will say, you get this therapy. And so you have to think about the fact that people have to first get diagnosed with COVID. And so think about who gets tested and who has access to testing. People have to have access to healthcare. Who has primary care doctors and who doesn't? And exactly as you've said, when they get to these health facilities, they have to be able to even sometimes know to ask their providers, hey, what about that new therapy, monoclonal antibodies? And unfortunately, because of the social determinants of health, things like healthcare access, things like education, things like access to testing, all of those are impacted differentially by racial and ethnic group. So if you can't even do the things you need to do to get to be in front of someone who could offer you monoclonal antibodies, of course you're going to get them less frequently. And of course we're going to see what we're seeing. So I wouldn't put it on, the kind of non-white patients who are suffering these consequences and maybe they're not advocating enough. I would take a look at the structures that we've set up in our society, both within healthcare, but even beyond that, and say, what's going on that these groups can't access what they need to access?
Yeah, tell us how Just Equity for Health is addressing this issue. That's your organization for
So,
our viewers.
yeah. Yeah, so I work in health systems design, and I think about how we design our health systems because health systems and the way that we deliver care don't happen out of nowhere. And so for me, the question that we really pursue at Just Equity for Health is what is the health equity lens that we're applying to the way that we deliver care? And that's across the gamut. How do we deliver care for hypertension, for diabetes, for HIV, which is the disease that I tend to treat most often? And how are we making sure that that care is equitably delivered to those who are at highest risk for those conditions and those who have historically been most impacted by those conditions. And a lot of times when we design different parts of our healthcare system, we don't think about that question of how are different groups being impacted. And we also, one of the things that we have to do is bring those groups to the table and say, how do you want your healthcare designed? And so a combination of those elements is what we do at Just Equity for Health.
Got it. I want to ask you another question based on what you just said about your organization, right? The pandemic basically shined a light on a lot of inequities in regards to our healthcare system. What were you most surprised to find out when it comes to Black and brown folks?
Oh, that's a fantastic question. I was most humbled and surprised to see the exceptional care that I think a lot of Black communities took in asking questions about the vaccine. And I know people have framed it as vaccine hesitancy in Black communities, and Latinx communities don't want the vaccine, but it really came from a place of understanding how they've been treated in this country historically and currently, and wanting to make sure that they would be safe in taking these life saving measures. And so the care and the kind of carefulness with which these communities really drilled us in the medical community was something that I was surprised by, humbled by, and really glad to see. Because if you've gone through what Black people have gone through in this country from enslavement onwards, you are not surprised if they have questions when the government suddenly shows up and says, here's something that I can give you that'll help your health. And so it is surprising, I think, when we're in the middle of a pandemic to see how many Black people said, I don't necessarily want it. But I think it comes from a place of really wanting to evaluate where they were standing, and what was behind the different therapies that were being offered.
Yeah, my last question for you, and I hope it's not a loaded one, but I want to know, based on the data that your organization collected, the face of a COVID patient, Black or brown, right? What were the chances that they survived?
So the chances that it really it's an interesting question because it relates to kind of what we understand about COVID's progression. So the chances that someone survives a course of COVID, if there's someone who's going to be more sick, really depends on where they present when they present. And so if you're presenting to the emergency facilities later on in the course of your illness, it is less likely that you will be able, it's more likely that you'll be placed on a ventilator. Those who are placed on ventilators, we know, will go on to do worse. And so this really, again, gets us back to the kind of beginning question of, when are people presenting? When are people accessing care? Why are they delaying their care? Are they afraid of healthcare costs affiliated with this? Can they get access to ambulances to bring them into the hospital? And so there's really that question of the kind of severity of illness upon presentation that absolutely impacted how people did down the line in terms of whether they survived COVID infection or not.
Yeah, I appreciate you answering that question for us. If you could answer this next one briefly, and then I do got to go because I'm running out of time. For those that did, you mentioned what was the barrier to keeping them from getting assistance or care when they first got symptoms. Do you think it's based on the fact that some folks just don't have the PTO or perhaps transportation? What did you find?
Absolutely, that and this is more anecdotal than research that my organization or others that I've seen, but
Yeah.
definitely in talking to patients, they will tell you, doc, I would have come in earlier, but I couldn't because I was working, or I couldn't get the time off, or whatever it is. And you have to understand, people are really fighting multiple pandemics, if you will. They're fighting the pandemic of poverty, of racism, and of COVID. And so they have to figure out which one is more severe before they kind of take the action that'll be most protective of their health. And I think we definitely saw people picking and choosing what they would do that would kind of impact their health based on which they thought would be most pressing for that day. And so if you're afraid that you're going to lose your job if you don't show up, you might show up when you're sick. And unfortunately, that might mean that you get sicker and don't do as well down the line.
Yeah, yeah, and you're also putting other folks at risk as well. It's just a double-edged
Hmm.
sword, and it's a vicious
Hmm.
cycle. Dr. Stella Safo, it was a pleasure. Thank you so much for joining us. And continuing with COVID-19, right? The vaccine could eventually become an annual shot, just like the flu shot. At least that's what Pfizer's CEO